Great. So first of all, welcome to all of you. I'm Howie Forman. I'm the faculty director of our healthcare programs in the healthcare management program at the School of Public Health, but also many of our healthcare programs at the School of Management. And I'm here joined today by my co-director of the healthcare management program in the School of Public Health, Claire Masters, and three students who I'll have introduce themselves in just a few minutes. I want to just do a brief overview of what we hope to cover today. And I want to just encourage you to think about questions as we go through the session. We're going to make sure there's absolutely enough time for you to ask as many questions as you have. And we'll also all be available to you after that to answer your questions as they may come up. The School of Management and the School of Public Health have a very close working relationship. We have several programs that operate together. Some of them are degree programs, including the healthcare management program in the School of Public Health, which offers an MPH degree in healthcare management, but takes many of its courses at the School of Management. There are also many co-curricular activities and extracurricular activities that bridge the two schools. But today we're here to talk about our joint degree MPH MBA program, which has multiple tracks really, but we're going to specifically address two of them today, which are the 2- and the 3-year track for completing the MPH and MBA degree. The 2-year track we describe as the dual accelerated track, and the 3 years are more traditional 3-year MPH MBA, where students spend 1.5 years in each school during their time at Yale. The 3 students that are joining us today are all in the 3-year track. So I'm going to just start off and briefly describe the 2-year track. I'm then going to let Claire Masters give you a brief introduction to herself and just add a few points about our dual degree offerings as well. And then I'm going to let our students introduce themselves, at which time they'll tell us a little about where they came from before Yale, what type of internships they may have already done since they've been here, and what they plan to do in the future, if that sounds okay for everybody. I want to just briefly explain the 2-year program, since you're going to hear more about the 3-year program. The 2-year program starts in the first week of July, typically the first available weekday in July, and ends in May of the subsequent year, or 2 years subsequent. So it really is a 22-month program, or 23 months, depending on how you count it. You really can complete both degrees in that period of time. It is a highly compressed schedule. It also has limited electives compared with a 3-year program, and it is only in the healthcare management discipline, whereas the other dual degree programs do offer the opportunity to do a separate concentration in the School of Public Health. Having said all of that, we've been really fortunate to have between 1 and 6 students a year, roughly, doing the dual accelerated program, and they all have loved it very much. So it is a self-selected group. So the people who choose to do that 2-year program end up being really happy with it. They do not feel like it was overly constrained. They are actively involved in all the activities of both schools. But nonetheless, I just give you that fair warning that it does not have the luxuries that are available to the 3-year program and that you'll hear about with our current students today. And we're happy to take more questions about that. But as with all of our programs, all of the joint degree programs, you will still be applying to both programs either at the same time or in sequence. You are welcome to apply before you come to Yale. You're also welcome to apply to the other school once you've come to Yale. If you're going to do the 3-year program, we strongly prefer that you do the School of Public Health first. We believe that by having subject matter expertise in the School of Public Health, that you bring more to the table when you arrive at the School of Management, and where the School of Management really does lean very heavily on your personal lived experiences in both life as well as your professional career. I think I'm going to pause there. I'm going to hand it off to Claire Masters, and then we'll do introductions with our current students.
Hi, everyone. As Howie mentioned, my name's Claire. I'm his co-director for the Healthcare Management MPH program at the School of Public Health, but also the dual degree programs, the accelerated and the 3-year program as well. So as Howie mentioned, the accelerated program is only in the healthcare management concentration, but we have lots of different concentrations represented in the 3-year program. So Cecil, Gauri, and Julia are all in the healthcare management dual degree program, the 3-year program. But it's very common to have students from health policy, socio-behavioral sciences, and many, many other concentrations at the school. So what I typically help you with is your internship and full-time job search, registration issues, which become a little bit tricky in juggling, degree requirements for 2 degrees. And making sure that you do all the requirements in the correct, sequence. I will add one extra point in terms of the 3-year versus 2-year dual degree program. I think the 3-year program really gives you a little bit of extra flexibility to pursue things like exchange opportunities, additional internships, electives in areas that you really want to have a deeper dive on. SOM has a great curriculum around social entrepreneurship and a great life sciences, set of classes. And so there's lots of opportunities that you can pursue in addition to leadership opportunities, which Gauri, Julia, and Cecil are all sort of, undertaking right now. And they'll talk a little bit more about that now. I may as well hand it over. So you're happy with that, Howie? Okay, Julia, do you want to talk a little bit more about your experiences and what you're involved in right now?
Yeah, for sure. So nice to meet everyone. Julia Phaltankar, obviously, as Claire mentioned, Gauri, myself, and Cecil are all part of the dual degree MPH MBA, specifically within the healthcare management program. So I think going chronologically, starting with how I got to the School of Public Health and the School of Management. So I was working at Epic Systems doing project implementations. So the healthcare IT software company. Was doing that for a couple years before moving on to YSPH, starting the healthcare management program. And then it was in the middle, actually, of my last year at YSPH that decided that I kind of wanted to go and pursue the MBA. So now in my MBA year, have had a major blast, kind of switching schools a little bit, getting more exposure to SOM. And then I guess the other thing that I'll add is between last year and this year, so this past summer, I was an administrative intern at the Cleveland Clinic. So I think that's a little bit about me. I think we'll probably touch on a little bit more of kind of what we're involved in a little bit, but we'll pass things off to Gauri to introduce herself now.
Awesome. Thanks, Julia. My name is Gauri, and yes, just like the other two, I'm also part of the 3-year MBA MPH program. Thinking about my timeline, so prior to grad school, I was a healthcare consultant at Huron, and I also worked as a research fellow for a policy think tank based in Boston, did a lot of healthcare and life sciences policy there. I personally knew that I wanted to do the dual degree before I came to Yale. So that looks a little bit different where, yes, you can apply while you're a first-year MPH, but then you can also do the application for both prior to coming. So I knew that I was going to be doing the joint degree before I got here, applied to both schools separately. You have to get accepted to both separately as well. I've been really enjoying it. Just like Julia said, the schools are awesome. They're different in their own ways, but the communities are great. And there's just so much to get involved in here at Yale. And I'm also did the MPH first last year, did the core, did some electives in the spring, started the MBA core this year. And in between the 2 years this past summer, I was in DC. I was at the National Pharmaceutical Council, and I was doing stakeholder and policy strategy work with the company. So yeah, lovely to meet you all. Thanks for joining today.
Great. Cecil.
All right. Hi, everyone. Thank you all so much for being here. So my name is Cecil Ehirindu, pronounced he, him. So prior to Yale, Actually came straight from undergrad. I went to the University of Oklahoma, and so came straight into the healthcare management program at the School of Public Health. And then throughout my time at the School of Public Health, we were exposed to classes like accounting and microecon, and I was exposed to just a different way of thinking, and being able to apply myself in a way I never thought of before. And so that's what encouraged me to apply to the dual degree MBA MPH program. I have a unique track where I'm a Silver Scholar, which is a unique program that accepts people straight throughout your first year of grad school or straight from undergrad. And so I have a different track than Gauri and Julia, but still 3-year program. And just like Julie and Gauri have talked about, I've been having a great time in both programs, but being at the School of Management has allowed me to have diversity, not only like in like experiences, but the thought, the people in the community. Speaking about like the community, I love the idea of giving back. And so I'm involved with things like the co-president for the Black Business Alliance. I'm involved in the healthcare conference, and I'm the first year student government community and inclusion chair. So that sounds like a mouthful. It sounds like a lot, but I definitely do feel like there's a lot of room to grow for me. And this route, this degree has exposed me to just different areas of places that I never thought were imaginable.
And I do want to just remind everybody, we're going to take questions live at the end of the segment. And if you have trouble speaking live, we will use the chat box. We will answer all questions. I do want to answer one question myself right now that I should have mentioned right away. And that is, when you apply, if you are applying for both degrees up front, you may seemingly be designating yourself as 2-year or 3-year. But we, and by we, I mean me mainly, do not really care at the time you're applying. You have the option, as I think Gauri mentioned, to choose once we accept you, whether you want to do the 2 or 3-year program. And you are welcome to ask us and talk to us and make your decision well after the point when you've been accepted to both programs. I just want to make sure that was clear. Let's go in reverse order this time. We'll start with Cecil. And why don't you talk a little about the biggest co-curricular or extracurricular activities that you are involved in, and take as much or as little time as you want to explain those activities.
Yeah. So like I mentioned before, I am one of the co-chairs of the healthcare conference this year, planning it with Howie and Claire and just a bunch of other people. And it's become one of my biggest growth opportunities. Came in straight from undergrad, so didn't have a lot of experience, wasn't really sure what the conference entailed. And so being able to work with a bunch of stakeholders, planning a conference, this year's theme is AI. And so we're still building that, what that looks like. But just being able to lead 16, 17 different students and being able to be a part of something bigger than myself is something that I've loved to be like. I have been able to take a lot of like grace with and a lot of growth, I'd like to say. And then being a part of the Black Business Alliance community is something that has been big to me and is the reason that I'm here. And so being able to see different perspectives in like leadership and business, I've been able to plan events and then coordinate different events with other affinity groups, and that has allowed me to reach a different audience that I didn't know like imaginable. And as far as the student government, I'm the first year student government community and inclusion chair. That's something that I'm still growing in. I feel like I'm not the first person I think about when I think about inclusivity and community, but it's a role that I'm still growing in, and I just want to be able to give back, like I said. But definitely the healthcare conference is like my biggest role. Not just saying that because Howie's on here. I think that it's a great time to grow with people, and we have different committees such as the content committee, logistics, finance, and marketing. So being able to exercise different areas of my brain and talking to people professionally and just networking, it's a huge networking opportunity as well. And so those are just a few things that I'm involved with as well.
Gauri?
Great, thanks, Cecil. So I think so the way that I'll break it down is I'll kind of talk about general Yale activities and then more like school specific. So for me, when I think about YSPH, there's a lot of opportunities with student organizations within YSPH, like student groups. And then there's also aspects of volunteering public health opportunities that we're told about. So last year I did some volunteering for the Haven Free Clinic, which is a really cool opportunity that if you guys come, you'll hear all about. There's also opportunities to do research with professors and certain public health groups. So last year I did some work with the Global Health Leadership Initiative, doing public health work in Connecticut. And then looking at SOM specifically, so this year I have been getting involved in a lot of the student organizations here at SOM. They have a lot of different groups. For example, there's a healthcare and life sciences club. You have like a business and politics club, tech and society. There's just a lot of really cool opportunities that you can delve into. And what I really like about those is you can kind of take, I guess, unique branches within healthcare, right? So like, for example, with tech and society, they're super interested in digital healthcare. So that was something that I was like, hey, that's a really cool sort of avenue for me to participate in. So I'm part of a few of those student organizations at SOM as first year leaders, which is like an opportunity that you get when you join the MBA program and start your time here at SOM. And then the other thing that's really awesome is that Yale generally has a lot of really cool activities related to healthcare for all students. So I am probably the most active in those. So two of them are related to impact investing and sort of venture capital in healthcare. That's something I was personally really interested in getting more experience in when I came to Yale and wanted to work with student organizations or Yale affiliated organizations that is involved in that work. So with Yale Ventures, what I do is I work with faculty members and I figure out how to create business strategies for them to get sort of funding to kind of move from like a initial, I guess, proposal state to like a pre-seed seed state. The Impact Investment Fund is really cool. It's actually a student-run fund. It's super new and it's a Yale student-run fund. So we essentially work through a sourcing process, trying to find organizations in different deal teams to invest in. So I'm on the healthcare deal team, given that that's my area of interest. And so basically we will propose a organization that specifically has impact focus. So what I really like about that specifically is I think it intersects my personal interests of sort of public health and business and healthcare and kind of thinking about how do you, I guess, work in that niche and what does that niche look like, which for me is something I really, really value in just my life as a student and what I know I'll value in my career in the future. And then finally, I'm part of the Solomon Center, which is a health law policy center. Again, another really cool sort of intersectional opportunity, which aligns with kind of the work that I did before coming to Yale as a policy think tank fellow. And there I'm able to do some ad hoc research work, but they also have really cool speaker events and a lot of cool networking opportunities. That's the other thing too. Here at Yale, you really have just a lot of cool people that exist on the campus, whether it's students, faculty members, speakers. And so I would say that's a really good example of being involved in an entity that, you know, you can kind of exercise your knowledge in, but then also get a lot out of. So yeah, so that's kind of what I'm involved at here on campus, try to do a balance of like interests and then kind of career oriented work. But it's been super awesome. And with the dual degree, you really do have like the opportunity to, you know, with the 3 years, you do get a lot of time. You get more time. It's not a ton of time, but you do get more time to sort of explore all of this. So yeah, on to you, Julia.
So Gauri actually touched on it a little bit, but I think the thing that I'll talk about is the Haven Free Clinic. So maybe expand upon it a little bit more. So as Gauri mentioned, it is a free clinic that is run by Yale students. And what's really cool, I think kind of speaks to the interdisciplinary nature of the Yale degree, whether that's at SOM or at another school entirely. It is a clinic that's run with the School of Medicine, the School of Public Health, SOM. There are other people involved in what as well. So a lot of different ways you can kind of get involved, whether that's from a true day-to-day standpoint of actually seeing patients, you know, if you're a medical student. For me, the way that I've kind of gotten involved with Haven is through the QA/QI department, so the quality assurance department. And essentially kind of what we've been tasked with doing is, depending on the specific needs of various departments within the clinic, they'll kind of give us projects and then give us pretty much free reign to figure out how we might be able to solve the issue at hand. So just to kind of give some context to that very vague statement, last year, one of the big projects that I've been working on over the span of the year was there were some patients that were leaving maybe too soon before their kind of clinic day was kind of over. And so we wanted to mitigate that loss to follow-up, make sure that, not only did the providers know where the patients were, but also that the patients knew how many appointments they still had left in the day. And so we shadowed the clinic, kind of devised some particular solutions, both within Epic, as well as just from a process standpoint that we ended up implementing that has hopefully, I think based off of what we've seen so far preliminarily, been able to kind of reduce that loss to follow-up within the clinic. So still involved in that right now, doing a different project, but definitely one of the more rewarding things I think that I've been involved in at Yale so far. And then a couple other things that Cecil and I have done together. We both played intramural basketball as part of YSPH, which was a lot of fun. I think this year maybe I'll sign up for both teams. I'll do YSPH and SOM. So we'll see. But it's been a blast. They're obviously based off of the varied interests that Gauri, Cecil, and I have just kind of stated within the past 10 minutes of us speaking. There are a lot of different ways that you can kind of get involved and really be able to find your niche within the broader Yale community.
Starting this time with Gauri, I wonder if you just tell us what has either surprised you most or been most exciting or fun in New Haven that is not part of your curriculum? Like what surprised you in coming to New Haven? All three of you were not in New Haven before.
Yeah, that's a really good question, actually. Well, I think for me, the one thing that I really appreciate about New Haven and sort of the way that Yale's campus is structured within the city is I think there's a lot here that isn't related to Yale. Like I think there's a lot of history in this city that is not Yale specific at all. And I do feel like it's just like a personal thing, but I think like, when you come to a community, when you come to a space, it's always good to be aware of like where you are, who the people are, kind of who live here, etc. So I think there's a lot of opportunities to engage with that. I know that people go as far to do a lot of like volunteer work in the community, which are really good opportunities. People also, just engage with the community, whether that means, trying out the new restaurants or, trying out the new sort of spots. There's a lot of, I'm sure you guys have heard like New Haven pizza, like, there are things that this place is known for. And I think it's also just being aware that there is a community that kind of exists outside. New Haven's also beautiful. So I really love like fall right now is gorgeous here. There's like state parks, there's a lot of nature. Again, I think the campus is kind of intertwined really nicely with the area. But I think for me, I think the biggest sense that I've felt kind of being here is like a feeling of community. And I think that could be a result of being at Yale. That could be a result of the way that the city is. But it does feel very comforting. Like I think having been here for a year, I feel very comfortable. I feel very sort of at home. And I think that, that's a testament to the people, but also to the place. So yeah, I would say that.
It's great. Maybe I'll go to Cecil next. Same question.
Yeah, I think Gauri kind of stole my answer, but I think for me, there's so much to do in New Haven, and I think that is another reason why I wanted to do the 3-year program. I just felt like I wanted to maximize my opportunity here, and I've been able to go to a lot of events outside of like the SOM bubble. They have this thing called like Yale Connect, and they have a lot of events that are on there, not just like Yale specific, but one thing that I went to this year was Black Wall Street. It was like in the New Haven Green, and it was just like amazing to see a bunch of vendors, a bunch of like entrepreneurs, and meet like a bunch of different people that I wouldn't regularly meet. Going back, I came from the University of Oklahoma, which was a college town, and so I was so accustomed to that way of living. So when I came to Yale, I thought it was going to be the exact same style, but it's really just a city, and Yale's here, and there's a way to differentiate. So Gauri talked about community service. I also do this thing called New Haven Reads, where you read to like I don't want to, you read to younger kids who may not be as literate or have the opportunity to, maybe just don't have the same opportunity that, I had growing up. And so it's just like a way to give back. And I think that it's really surprised me how like there is a huge community at, in New Haven. I feel like I'm stealing Gauri's answer, but honestly, like I've loved my time here, and I feel like I've been able to capitalize on opportunities that I wouldn't have had if I wasn't exposed to like, SOM or just been at Yale in general. And so yeah, that's what surprised me so far.
What's your favorite restaurant or food before we move on?
I'm not a pizza guy because I'm lactose intolerant, so that's just nothing for me. But I think
Okay.
for me, love I went to September in Bangkok, and I think that's something that I really like love right now.
Good.
And yeah, I definitely want to go back there. So I'll probably be a regular there for a while.
All right, Gauri, fill in that gap before I go to Julia. What's your favorite restaurant or food in New Haven?
Yeah, so I'm a big coffee person, and there is a new coffee shop that opened up in downtown called MOTW Coffee, and they have like Yemeni coffee, and it's amazing. It's does the job too. It's keeps me up. So yeah, that's got to be my
great.
favorite.
Good. Julia.
I guess just to answer the restaurant question, I would say mine's Sitar, which is an Indian place, and it's really dangerous because I literally can like see it from my apartment. So the people there kind of know me now, I think. I've signed up for their rewards, so definitely recommend checking it out if you guys ever end up moving here or have the opportunity to visit. It's really good. But I guess going back to kind of the previous question about maybe what has surprised me about New Haven or some of the things that I've really enjoyed so far during my time here. Going to sound like a broken record, but I would also just say the community. I think to be completely candid, one of the things that kind of scared me about Yale was the fact that it wasn't in a big city. I figured, being in my late 20s, I would kind of want to spend that time like in a larger city. Just I think as probably a lot of people kind of share that same sentiment. But I've been very pleasantly surprised. I do feel like one of the main reasons, at least for me, why I feel like there's this strong sense of community here is that you are kind of not forced, but people choose to stay in New Haven on the weekends a lot of the time. And so you get to know people, obviously, outside of the classroom, outside of the activities that you're doing, in a kind of much lower stakes sense that you normally would. And so I really do feel like it kind of organically brings about this feeling of community. That's not to say that every now and then, I need to escape New Haven a little bit, and I can just hop on the Metro North kind of whenever I want, go into the city for concerts, come back out. So I really do feel like there is a very good balance in terms of making sure that you have this sense of community. You're really taking advantage of everything that is here. But if you do need to, take a breather or go experience more of like the big city life, you definitely have that opportunity as well.
I'm going to start off this time with Claire, and we're going to go to questions right after the series, but we're going to make it quick. I'm going to start off with Claire first for her thoughts on restaurants and food, but more importantly, I wanted her to just give an overview of her perspective on how the MPH MBA students do in their internship and job search, and then let each of you weigh in with anything you want to say about that process, because I know you've said some things before, but I just want to give you a chance to add on what you've already done and what you're going to do in the future. So Claire, tell us your food.
Well, I feel like I have to represent the New Haven pizza contingent, and my favorite is Sally's and has been for about 10 years now. But bar is another great option. The salad at bar is really good. There's so many cute places downtown that you can grab like a happy hour bite or something like that. And it's really affordable to dine out in New Haven. I say this because I live in New York now, and I really miss New Haven and the dining scene. So in terms of the internships and the job opportunities that our, accelerated and 3-year dual degrees get, it's pretty impressive and very diverse. We've had folks work at places like Pfizer, thinking about last summer, it was Pfizer, healthcare consulting, so Chartis, Deloitte is another great option, many to choose from, Manat. And then, some folks go to work on the payer side. So we had a recent graduate go work with United Healthcare, and they're working on some really interesting projects there and had a lot of say in terms of what they could do. There are lots of great healthcare leadership rotational programs as well that are available to students who are interested in healthcare. A lot of the big life sciences companies do those, as well as the payers. You know, had a lot of folks go work at Kaiser Permanente as well, if they want to return to the West Coast. But we've also had folks work in government, you know, CMMI is one option that comes to mind. Howie has really great connections to folks that are leaders in public service organizations. And so that's something that students have explored a lot. But at the same time, you know, have been really involved in projects like leading the Haven Free Clinic and leading the conference. It doesn't, you know, the job search and the internship search doesn't really become so onerous that you don't have any time to pursue other opportunities on campus. So I think, you know, I see the students have a pretty good time while they're doing everything. It's a big juggle, but I think there's a lot of support. There's a lot of support at YSPH and also at SOM, and you have the benefit of being able to take advantage of the resources at both schools. And they do very different things, and they have different connections to different employers and different industries as well. And so I think the combination of the two really serves the students very, very well.
It's a good segue for Julia. How did the two schools help you, and what did you do, and what are you doing?
Yep. So I kind of mentioned in my intro. So over the summer, I was at the Cleveland Clinic doing a graduate administrative internship. So I was in the Primary Care Institute, learned a lot from that capacity. Admittedly came into the MPH thinking that I was going to exit also doing something within hospital administration. I do think one of the big benefits of being in the 3-year program is that you do have the opportunity to have another internship under your belt, which I think has relieved a little bit of pressure on my own end in terms of trying to figure out what I want to pursue, you know, post-grad. So this summer, I'm really trying to kind of recruit for things that are a bit of a 180 from hospital administration, still sticking within healthcare, but looking at things kind of like general kind of management consulting. So some of those larger firms, healthcare consulting at some of the firms that Clara mentioned, as well as even some internal kind of enterprise strategy, internal consulting roles at some of the larger pharma companies. So definitely casting a bit of a wide net, but really want to take advantage of the fact that we do have this additional summer to really kind of think things through. And I guess speaking to some of the resources at both of the schools, I do think, for one, the peers, a lot of the healthcare management peers that I had last fall when we were doing recruitment were also looking at graduate administrative internships. So in that sense, it was kind of a wealth of knowledge with people being very open of sharing, you know, I applied here, this didn't necessarily work out for me, but maybe this is something that you could potentially look into. So definitely super helpful there. And then now kind of doing consulting, which is something that I've never had any exposure to. And I think most folks probably know, you know, consulting has a very unique interview kind of path with the casing component. So given that that was really new for me, one thing that I've really leaned heavily on at SOM is the consulting club. So it's completely student run for the most part, with some CDO partnerships as well, and basically has second-year students that maybe had internships the prior summer at some of the, you know, McKinsey, Bain, BCG, those kinds of places. And they really take you step by step to help you figure out, you know, the ins and outs of casing, as well as set you up with other resources, you know, other first years who are also in the same boat of practicing mock casing and stuff like that. So have definitely utilized a lot of the resources at SOM and YSPH, and really excited to see kind of what happens this summer.
Great. Cecil.
Yeah, I think going off of what Julia was speaking about, so for me this past summer, I was also an administrative intern at it was in Texas. It was this hospital called JPS Health Network, and I was in their behavioral health unit, and it really exposed me to the ins and outs of a hospital system. Got to meet with the CEO and a bunch of executives, and it was a great time all around. Me being in the dual degree program, I don't have I have a lot of flexibility, like Julie was speaking about, but my path looks a little different because being a silver scholar, I will have to take or I get to take a year to 5 years off to work and come back and finish my third year with the dual MPH MBA. Me and my friends have this joke that I'm not going to graduate till like 2030. But it's just very, it's just very lightheartedness all around. The resources that I've been able to, I guess, take full advantage of is one, my peers. I'm in classrooms with amazing people who have came from huge industries, different types of backgrounds, and I just really take this path with and I really like I take this path with an iron fist. It's really difficult. I'm gonna be honest, being a silver scholar, you get to an interview and when the only thing that you don't have on your resume is like the years of work experience, but you're qualified, it's a little difficult. But I do believe that the program is set up to where the people like Julia and Gauri, when I'm, come back in 2030 and I want a job, those people that will be like a network for them to like to hire me or like reference me or something like that. And so we also have a lot of like resources like the CDO office, or the CDO, which is really the career development office, and they have a bunch of job postings, a bunch of like things you can do, like behavioral interviews or just general tips about career and like advising. The consulting club is something I'm also part of. I'm, like Julie said, casting a wide net. So that's consulting, that's looking at healthcare startups, that's looking at just like internal strategy roles. I'm really open to anything. The world is like my oyster, so I can do pretty much anything I want in this 1 to 5 years, hopefully 2 to 3. I don't want to be 5. We'll see where the world takes me. But I think that being able to utilize the healthcare management courses and then integrating that with like the School of Management courses, the core classes, I've been able to use the practice in the classes or the theory in classes and use it in like practice. And so that's been able to help me with like the casing. That's been able to help me with just like having like being more professional, whether that's having coffee chats, whether that's learning how to talk to like other professionals that you aspire to be like. And so kind of all over the place right now, but I do believe that with the people that are by my side, I've been able to be more confident in my ability. I have a lot of imposter syndrome, just being at a really young age and being in these classrooms where you feel like you may not be as like qualified, but we're all in the same place, and I'm taking full advantage of that. And hopefully in the future, near future, I'll be able to have a job and come back and just finish my dual degree.
Great. And we'll just finish up with Gauri.
Yeah, I think Julia and Cecil hit on a lot of the important points. I will say, so my personal background, like I already kind of mentioned, is kind of the intersection of policy and business, and specifically in pharmaceuticals. I developed an interest in that when I was working post-grad. And that's really why I chose the internship I did last year. I wanted to work at a federal policy level. And kind of looking forward to post-graduation next summer, thinking about, market access, public government affairs within pharma, whether that's at a policy organization similar to what I did or a corporate pharmaceutical company. So that's kind of my sort of path of career right now. I think in terms of resources, I think, again, Julia, Cecil, they hit the main ones. But one thing that I really will say is I think like at this point in your career, I will say your mentors are honestly what carry you through in terms of conversations, in terms of networking, in terms of just giving you guidance. Even for last summer, I remember I emailed Howie, and Howie is, if you guys probably already know, but if you come here, he is like a know-all. He like knows everything. He knows everyone. And I remember I like emailed him very, briefly, was like, hey, I'm interested in this. Do you have any thoughts? And he immediately was so helpful with connecting me with people, allowing me to set up coffee chats. And honestly, that was like the domino effect for me to be able to get the internship that I did this past summer. So I will say, like, in addition to all of the school resources and kind of the students and the peers and the actual, career development centers that are there, really utilize the people that are here. The faculty that are here are incredible. They're usually like, pioneers in their fields, or, they have a lot of connections. A lot of people really respect them. So build those relationships, have conversations. And I think that also allows you to figure out more about like, there's a lot of things that I still don't know about even the industry that I'm interested in. And I think like it's through conversations and coffee chats, or even just, casual ones where I'm like, oh my gosh, like I didn't even realize that was a possibility. So that is the extra thing that I'll add onto what Julia and Cecil said.
It's great.